Contrary to popular belief, chronic muscle pain is rarely caused by the muscle itself. While injury to the actual muscle certainly happens, the injury is usually short-lived as the muscle tissue tends to heal rather quickly. Instead, the source of long-term muscle pain and dysfunction is most often found within the fascia, which surrounds the muscle and all its fibers. Fascia is a dense connective tissue primarily formed from collagen fibers. It surrounds and interpenetrates every muscle in the body, aiding in the strength, mobility, and elasticity of the muscles. When well hydrated, fascia is highly malleable and takes on a gel-like consistency. This allows muscles and muscle fibers to glide over each other smoothly and gracefully during motion. If the fascia becomes dehydrated, it loses its plasticity and begins to stick together, gluing down muscles and muscle fibers in the process. This can inhibit movement, keep nutrients from reaching the muscle tissue, and cause pain or dysfunction within the muscle. Unlike the muscle tissue itself, the fascia doesn't receive its fluid from the pumping of the heart. Instead, it relies on movement to push the fluids through its matrix of fibers, hydrating them along the way. Dehydration of the fascia is almost always caused by a prolonged lack of movement. This can happen when certain muscles are immobilized due to injury, or when the full movement range of certain joints isn't utilized due to poor posture or repetitive short-range movements. In all these cases, the fascia becomes dehydrated and glued down to the surrounding tissues, further limiting movement and thus further building up dehydrated layers of immobile fascia. These patches of built-up fascia are known as fascial adhesions. The negative feedback loop caused by these adhesions continues to limit movement, cause pain, and degrade the function of the muscle and joints over time. As the dysfunction and pain continues, exercise and recreation are often stopped. Soon mundane daily movements become too taxing, and they are ceased as well unless the cycle is broken and normal movement restored. To restore proper muscular function and regain pain-free movement, the fascial adhesions must be broken down and the fascia rehydrated. The best way to accomplish this is manual therapy directed specifically at the fascia. A manual therapist who understands the fascia well can break down the adhesions and reintroduce movement locally at the site of dysfunction. In this way, the bound muscle tissue is released, pain disappears, and normal movement capacity is restored.